Hello everyone, my name is Revel Harris and welcome to the I Am Me podcast. Today we are joined by an incredible woman, a multi-award winning HIV clinician and one of the best HIV clinicians in the country, Dr. K. Mahomed. Welcome, Dr. K.
Revel, thank you so much for that wonderful introduction.
Only a pleasure, only a pleasure. To shoot straight into it, Dr. K, why HIV and AIDS as a career, as a doctor?
My story is quite interesting. I was a stay-home mum.
Okay.
I was raising 4 kids. And I remember the day so clearly. It was January 2005. I was at the gym and my kids were having a swimming lesson.
Yeah.
And I bumped into an old colleague. And he was absolutely horrified that here was I sitting in the gym, not even using the gym, he says, like a queen. He was so horrified. He said, well, this is the last day you're going to be at home. Tomorrow morning, you have to get to Helen Joseph Hospital. I had no idea where Helen Joseph was.
And this time you're already a full-fledged qualified doctor.
No. I'd been a doctor for 40 years.
Oh,
remember
wow.
that. So it's like I worked for a bit and then I had too many kids and then it's like school and swimming and madrasa and all the extramurals. And with 4, it's a little bit hard to work as well. So then the next day I went to Helen Joseph Hospital. He told me how to get there and where to get to. And he said to me, and just get to the back of the renal unit and look for an NGO called Right to Care.
Okay.
So I get to Right to Care the next day. It was a Friday morning, and the CEO of Right to Care was Dr. Ian Zana, and he asked me, what did you know about HIV? And I went, nothing. So he said, it's not a problem. If Dennis Rubel has recommended you, you can go to the next CEO. He said, Dennis has said, you come from the era of where you see one, you do one, you teach one.
Okay.
So just going on that, I'm not going to waste my time with you.
Yeah.
And then I went to the next CEO, who was Temi Zulu, and she said, Kay, will you head to the staff office? And I was on their payroll, and I've never looked back. At that time, we saw 800 patients a day.
What?
I sat next to Dennis Rubel for 3 months, and he taught me everything I needed to know. And at the end of that 3 months, he said to me, bye, Kay, you're in charge of the clinic, and I'm gone.
Oh, wow. So that's where the journey started with HIV and AIDS.
Started, yes.
Wow.
And I've never looked back.
I mean, you've assisted over hundreds of thousands of people, you know, from the mere man on the street to high qualified people that have contracted HIV and AIDS through whatever form, you know, because it's not always a sexual form that you can contract HIV and AIDS through. Explain to us the importance of your work in today's society.
The biggest problem I think we have, even to date, is the stigma.
Yeah.
And I think the 2 things I address is an education. So I explain to people what the virus is about, what the drugs do. And of course, if you don't drink your drugs, I will kill you. So they understand that. And then I say to them, drop the stigma in the bin.
True.
Because if your viral load is undetectable, tells me you're taking your meds, you're taking them properly, they're working for you 100%.
Okay.
You're as good as anyone who's HIV negative. You're not going to transmit HIV to a partner, even if a condom is never used. All your babies are going to be HIV negative.
Wow.
You're going to lead a completely normal life. So please tell me, what's your problem?
So this is where, and I was going to touch on it a bit later, this is where the U equals U comes into play, is when people take the ARVs and then makes you undetectable and untransmittable. With anybody who is HIV negative, that means they will stay negative.
Absolutely. But having said that, I do give discordant couples where one is positive and one is negative an education again to say, listen, if you're HIV negative, and you're in a discordant relationship, you have two options. It's not my choice. It's not your partner's choice. It's entirely your choice at what makes you feel comfortable.
Yeah.
So if you're happy with the you equals you, you don't need to take anything. But if you're uncomfortable with that, then you're more than welcome to go on to PrEP.
Ah, true.
But it's entirely your choice. It's not my choice. It's not your partner's choice.
Yeah.
So sometimes I do influence people a bit. So if I have a gentleman who comes in and he's positive and the partner's negative, I'd like to say to the women, no, just take the ARVs. You must never trust, take the PrEP.
Yeah.
You must never trust a man. And I have everyone in stitches, but it's all about your comfort zone.
Yeah, true.
But that's how important the you equals you. And like I say to everyone, I don't have a single patient in my own rooms who's not undetectable.
Wow, that's
so
amazing.
I think it's the education, it's the knowledge, and letting them know, listen here, just get
and
on
be
with
empowered.
life. Yeah, exactly.
You know, it's no longer a death sentence as what it was in the 1984, 85, 86. Those days, back in the day, it was a death sentence. Now I mean, we've transgressed and, you know, we've transformed actually, you know, not transgressed as what we did in the past.
It's a whole new era. It just gives you a new lease on life, and of course you get to know me as well.
True. I mean, and medication has changed from when it was to a whole handful.
That's the thing with HIV, is that our meds are phenomenal. In the old days, we had meds that it was like a handful in the morning, handful in the night, lots of side effects, liver side effects, kidney side effects, neurological side effects, forgetfulness, memory loss, drowsiness, dizziness, even sometimes psychosis. All of that is in the past. So not only is the side effects in the past and the toxicity, but the drugs are potent. They will just smash the virus.
And they've evolved so much.
Exactly.
I mean, so many people, if you look at it, so many people are on one tablet a day. So this is the question I also have. Do people have to take their tablet every day at the same time?
No, it's not even like that anymore.
Oh, wow.
I say to patients, you get up in the morning, what's the first thing you do? You head to the bathroom. Whether you eat or you don't eat, I don't care. Whether you get up at 6 o'clock or 10 o'clock, I don't care. As you get up, you hit your meds and you're done. So it's not even like in the old days we said time.
Yes.
Not even that.
That's how advanced the medication is right now.
Done, and that's how beautiful the meds are.
That's incredible. And then, Dr. K, what's the latest PrEP drug that is coming to South Africa next year? Right, if I have it correct, it's coming next year.
Yeah, so we have PrEP drugs available now that you can take.
Yeah.
So what I would call TE and TAF-E, which is even better than TE, the TAF-E. But also next year, around about March, we should have an injectable available. Now, the phenomenal thing with the injectable is it's one injection every 6 months.
Yes.
But do remember, this is PrEP for HIV negative people, not for treatment.
So anybody who's positive, you will not qualify, obviously, to get the PrEP. Because PrEP is a
But anyone who's negative, and I feel especially excited for women. I'm sorry. But,
no, granted.
And for young people coming up, to say you would just have one injection every 6 months and you will continue to remain HIV negative. So that gives you one less thing to worry about.
And this has all been put past the testing phase and all of that. Now it's just roll out.
Testing. It's all about rolling out right now, because you must remember initially when it was available, it was too pricey and you couldn't put it on the market.
Yeah.
But now the license has been dropped, so it'll be rolled out as at the cost of the oral drugs.
That's incredible.
So that's going to be a big game changer.
That's incredible.
Forward.
So, Dr. K, since you were awarded the IME Medical Allyship Award at the 2025 IME Gala Dinner, how has that lifted you to even do above and beyond like you've always done?
I think in my own person, it gives me a lot of confidence to say people do acknowledge what I do.
Yeah.
So I feel very appreciated, and I do want to say thank you very much. But I also feel very humbled. I mean, really. I mean, I'm just doing what I thoroughly enjoy.
Yeah.
And
being recognized for it feels good.
Yeah, I must say it did put a feather in my cap when I was recognized. But I generally say to everyone, I think I was handpicked by the Almighty to do what I do.
Yeah. Definitely a calling.
There is no other field of medicine that can make you feel so good. I am looking after patients now for 20 years. So when I was at Helen Joseph in the old days with Right to Care, we ran an adolescent unit there, and I would see these little kids who would come in with their goggles, and Gogo would talk and they would be absolutely dumb.
Yeah.
And a few months later, they would still come in with Gogos, and they would be talking and Gogo would be dumb. And a few months later, Gogo was nowhere in sight, and they were there on their own. And now I see them in my practice with their families and their high-flying jobs. And I was
removing
like
the stigma once again.
Yeah, no, there's just no stigma there at all, really. It's all about our kids, our families, our careers, and that's where you want to be in that spot.
True.
So I don't think, if you're in the right space, the HIV shouldn't even feature.
And speaking of that, how important is it on this day today, which is 1st of December 2025, World AIDS Day, to know your HIV status?
That's a start-out point, isn't it? Mm-hmm. If you haven't tested, you would never know.
Yeah.
And don't wait to get ill and then test. Just be a smart aleck and just test, And then that gives you two options.
Yeah.
That gives you the option of ARVs, and that gives you the option of PrEP. But I just think just be smart.
Yeah.
Just go out and test. I mean, that in itself is telling me at what IQ you're taking if you're already testing, And
true that.
In my own rooms, I'm testing for free as well. You can happily come in, and it's not even one drop of blood. Hey? It's just a swab in the mouth. And in 3 minutes, we can tell you whether you're positive or negative.
And I mean, with 8 million people, 8 million and above people in South Africa living with HIV and AIDS and being on treatment, how incredible is that? I think we've reached an 80% almost percentage of people that are HIV positive who are on treatment, and who is getting that number down from being detectable and transmittable. That is incredible, in 2025.
I must say our government has done a really good job. If there's one field they've excelled in, has been the HIV field. When I think about it, originally there were no drugs, only trials, and then only certain centers. And now you can access the ARVs at any clinic around the bend from you.
That's amazing.
And not only that, the price of the ARV is also down in the boots. So there's just no reason for anyone not to be able to get onto
ARVs
it at all. Even in private, the cost of ARVs is sitting at 10 rands a day. So it's like
that's incredible. And you spoke so proudly at when the award was given to you at the IME gala dinner, of how people need to come to you, and you will see them, consult them for free. The only thing they need to pay is the medication, which is, like you said, 10 rand a day.
You can't even get a can of Coke for 10 rands a day.
Exactly. So. If there's anyone out there who would like to see Dr. K, where do they find you, Dr. K?
I'm based at Garden City Hospital in Johannesburg, so you just have to look up Garden City Hospital, and I'm there.
And they'll find you.
Hospital, And like I say, it's just about you being smart, because if you are smart, you will test, you go into either PrEP or treatment. And not so much that, it also allows for the destigmatization, you know what I mean?
Exactly.
Even if you're coming in, it's a chat, you just become smarter.
Yeah, breaking the barriers of, this is judgment zone.
If it's not you, you're supportive to someone else, and that is what life is about. Do good and just be good.
Yeah, and I always say to the team as well, do good and good will find you.
Absolutely.
Absolutely. Dr. K, any words of encouragement to families, friends, and individuals that are affected or infected by HIV and AIDS?
just take your meds. Make sure you're on the best meds, because our meds have changed and you need to be on the newest stuff, because the newest stuff is super potent.
Amazing.
And not be on the old stuff we used 20 years ago, because that is like rubbish in this day and age. And as long as your viral load is undetectable, just go out and live your best life.
And I mean, thanks to technology, thanks to the advancement in the medical field, thanks to HIV/AIDS clinicians like yourself and others that are doing the absolute most and your best to make sure that people have a long and fruitful and successful life just by taking one tablet a day.
Now you tell me, how simple is that?
It doesn't get any simpler than that.
No, I'm dead serious. I mean, if you have hypertension, diabetes, all of it is just wishy-washy.
Yeah,
but
yeah.
with HIV, we spot on. Viral load undetectable, as good as new.
Oh, Dr. K, it was such a pleasure having you with us today on World AIDS Day, and thank you for inspiring not just myself but others to go out there, get tested, and do regular testing as well, you know, and also be safe and have safe sex as well when you go along life. And if you haven't had safe sex, go and get yourself tested. If you don't know where to go, like Dr. K said, get to Netcare Garden City Hospital. She's there. She will consult for free, but all you have to do is pay for your PrEP or your ARVs. Dr. K, thank you so much for your time. Truly appreciate. And to everyone out there, happy World AIDS Day. Truly, truly be comfortable with who you are. Go test yourself and take care of yourself. Dr. K, thank you so much.
Only a pleasure, Revel.
Truly appreciate your time.
Thank you.